With Dr. Jason West is brought to you by Marcus and Mack, a law firm representing injured people. And he joins us all the way from Pocatello, Idaho. This morning, Dr. West is going to talk with us about coronavirus vaccine, everything we need to know about it, or everything that we know about it up till now. Good morning, Dr. West.
Good morning, and thanks for having me. And if your listeners are like the patients that I see in the office, one of the frustrations about the pandemic is where do we get good information? Mm-hmm. And especially as it's coming in right now, you've got 3 companies saying we have a vaccine and we can come to the market, and they're saying that it may be here as soon as December 11th.
It's amazing. It really is. Talk about, let's start there with the speed with which this thing has developed. That's raised some concerns from folks, but it's also raised a lot of hope.
It's a double-edged sword, because one of the things that everybody's wanting to know is, does it create long-term antibodies? And what I mean by that is the cold is a coronavirus. It's not COVID-19, but it's in the coronavirus family. And when it rolls around, our body has an immune response, and it creates antibodies. And then what happens is, for the common cold, those antibodies don't last very long. And then the next cold season rolls around, and our body kind of has to do the same thing. So on one hand, we're telling everybody, hey, get your immune system as healthy as possible, so when you do run into a virus, your body can respond to it. And then on the flip side of that is, well, if the coronavirus has the body create short-term antibodies, is the vaccine going to be long-lasting, or are there going to have to be numerous, booster shots? Mm-hmm. And then on the speed of it, usually it takes a couple years for a vaccine to come to market. There's tested extensively on thousands and thousands of people, and some of the preliminary data on the vaccine, although it's hopeful, it's not on a ton of people. And the people that tend to be more conservative or cautious that, wait a minute, is this as safe as it should be?
Yeah, those are all very, very valid concerns, and they can't be taken lightly. Now, you said something a couple of moments ago that piqued my interest. We think of vaccine, we think of the polio vaccine, we think of the measles vaccine, we think of those types of vaccines. But then the flu shot that we have to get renewed every season when a new strain of flu comes along, and we're wondering, well, with the COVID-19 vaccine, where does it fall in between those two extremes?
Well, with the flu vaccine, there's so many different variations of influenza in A and B. It's kind of a statistical, guess that the government has every year of, well, which strain do you think is going to come this year? And then not everybody gets it, and they're saying something, 40 to 60% effective rate. Now with the vaccines that the big pharma is telling us that are available, they're touting 70 and 90 and 94%. And the one thing that seems to be consistent in what I'm reading is that there haven't been a lot of mutations in the COVID-19 virus that would make it as difficult to predict as the flu vaccine. But also, it's just, and I'm telling people when they're saying, is it available for me to get December 11th? And I'm saying, well, it might be, but until then, maybe it might be December 11th, maybe it may be April or May by the time everything rolls out. But until then, it's a wake-up call. Get your immune system healthy, eat healthy and live foods, really ramp up your vitamin D levels, because we know that has a really positive effect against upper respiratory viruses. Get vitamin C, manage your stress. It's not a cure-all for the pandemic, mm-hmm. but there's some medical excitement that is occurring around this vaccine.
I would certainly think so. So one of the projections I heard this morning said 50 million by the end of December, 50 million more by the end of January, 50 million February, 50 million March, and you do it in those 50 million increments. But one of the aspects of it all is, are people confident enough, or are they too fearful to actually get the vaccine? Do they want to wait until they have more evidence? Do they want to wait until something is different comes along? All of those things have to be considered as well when you think about herd immunity, don't you?
Yeah, absolutely. And there's, I'm going to say that there is a lot of the patients that I am seeing are, and again, I have patients that have had coronavirus in April and in May, and many of them are saying, I feel fine now, I've recovered, I I've been antibody tested. They say that I'm not infectious to anybody else. I've had some other patients that are like, I just haven't recovered from this, where I'm not sick, I'm not in the hospital, but I don't feel sharp, my muscles hurt, I'm lethargic. And so you have that spectrum, and then also inside of that spectrum, there's people saying, I'm just going to wait and see what happens. Other people are like, sign me up, the minute it's available, I'm going to be right down there to get it. And it's just such a personal choice from a intuition standpoint, from a science standpoint, from a religious standpoint, from a political standpoint. All of those factors are coming into play when I'm talking with people.
It's amazing. All right, so take us inside this. We know the Pfizer one. We've heard about it. It's a 2-dose vaccine. Moderna's it's 2 doses as well, or is it 1?
I think that both of them are 2 doses. Don't quote me on that, but I think both of them are 2 doses.
The one Johnson & Johnson started testing on out in the eastern part of this state in Philadelphia, that's a 1-dose one. With so many different folks working on getting a vaccine that is out there, it seems like it's going to be a sifting through process to find the one that is going to be most effective. And in the meantime, folks are going to have to, trust their own judgment as to which one they want, if either, if any.
Well, it's true, and we're also, more and more people are pointing out that it's not just for, this sounds horrible to say, but it's not just for the benefit of mankind. Whoever gets out there and seems to be the one more efficacious, there's billions of dollars at stake, which when you put that factor in it, it just makes people a little bit cautious of, well, is it adequately vetted? Is it adequately tested? What is the data on it? And unfortunately, every now and then you have people that react not in the way we intended on the vaccine, and it just gives people some air of caution. And adding that to all of the stress for the pandemic, it's just leading to a really interesting decision-making environment. Really.
And, of course, we've got some governors who have said until our experts in our state clear it, we're not going to have it in our state. And that's a whole nother discussion. We're talking with Dr. Jason West from Pocatello, Idaho, medical expert, founder of the West Clinic there. Dr. West, when we think about something that you said a couple of moments ago, the ways that we can protect ourselves, from the beginning of this, we've heard about masking up, we've heard about physical distancing, washing the hands. Those aren't just COVID-19 measures when you get to certain seasons of the year, are they?
No, it's just good. It's good practice to do all the time. I think one of the best things, there was a study in Denmark that just came out of the Annals of Internal Medicine that was really looking closely at masks, and basically the synopsis of the study was that the physical distancing and washing hands seemed to be more efficacious than wearing the mask, not being around sick people. And again, one of the things that I wish was seeing in the media, and maybe it's because, bad news sells better, but I wish that we would be having the discussion of there are millions of people that have been exposed to the virus that are asymptomatic or didn't get sick. There's millions of people that have got over the virus. There's millions of people that or their immune systems are handling it right. And unfortunately, those with comorbidities and risk factors are being attacked, or they're being, unfortunately, they're dying. But at the same time, like, the coronavirus has killed less people than heart disease and obesity and diabetes, and it just seems like we've lost the concept that it comes down to individual health. If we can really focus on getting people healthy, then what happens is so many of the risk factors for the serious problems for the coronavirus go away.
The surge that we are seeing right now and the reaction to it from government sources and from, frankly, people in the general public who say, I'm just tired of it all, I'm going to go back to living my life the way that I am. Is there a proper balance between those two extremes?
Well, it would be, except no one knows who to trust. And the problem that you're seeing with some of the testing, and Elon Musk brought this to everybody's attention. He went out and did 4 tests. 2 were positive, 2 were negative. We don't know if the antibody test, which gives you information right away, is as accurate as we would like, and then the PCR testing has some different problems with it. And sometimes, you just wonder, is all of the all of these tests, are they accurate? And I don't want to come across as a conspiracy theorist, because I don't really feel that I am. But some of the data, you just kind of scratch your head a little bit and go, if you take a completely asymptomatic patient and you're testing them for a disease, and then we don't know if it's positive or negative, what does that do to the disease statistics? And on the flip side of the people that you think for sure they've got coronavirus, and they go in and they said, I was tested and it was negative, it just doesn't seem to pan out the way that you'd like. I mean, I just wish we had more confidence in the testing, which leads to the disease rates and the infection rates. I wish that we had a better feeling about that.
Yeah, you're right. One of the things about it is that if you cannot trust the person delivering or the organization or agency delivering the data, then you're certainly not going to trust their recommendations or their rulings and the regulations that are put in place. He's Dr. Jason West. I want to thank you for coming on board and visiting with us today. It's been instructive. I appreciate it.
You're welcome. And if people want more information, it's drjasonwest.com.
Very good. Have a lovely day today.
All right. Thank you.
Bye now. Dr. Jason West with us this morning from Pocatello, Idaho.